Welcome to this episode of Orthodontics in Summary. Today's podcast episode is looking at aligners and the effect of expansion on adult patients. This was an excellent lecture given by the seasoned academic Greg Huang at this year's AAO. I love this lecture for a number of reasons. Not only did Greg, the academic, declare his conflict of interest from the royalties from his textbooks, but also he spoke about the hard work of his trainees in carrying out this research and really acknowledged their efforts. He also hypothesized as to why there's a difference between bone loss and gingival loss and tried to work out why there was that discrepancy. An excellent lecture all around. Just to recap, the podcast is the opinion piece of myself and the Orthodontics in Summary team. We try our best to ensure it is as accurate as possible, but may not 100% represent the original lecture. So, what was Greg Huang's research? They carried out an investigation of expansion on adult patients, about 22 in the maxilla and 20 mandibular arches. The expansion arches had 3.7 millimeters of expansion. The controls had minimal expansion, 0.6 millimeters. They used CBCT data to look at bone height and width of the patients before and after treatment. So let's get down to it. What was the bone loss that they found? Well, interestingly enough, when they expanded in the maxilla, there was no real difference between both the expansion and the non-expansion aligner groups. And this was found to be minimal bone loss across both. It was the mandibular arch where significant differences were found. Now, in the expansion group, there was 1.5 millimeters of mandibular bone loss across the central incisor region. When it came to looking at other areas of the arch, there was a 1.4 millimeters of bone loss across the premolar region. What about movements that took place to the incisors? There was very little change for the inclination of the maxillary incisors. Again, the mandible seems to be where significant changes happen. There was significant tipping of those lower incisors. So overall, the changes, well, actually the expansion delivered was quite significant. It was 3 to 4 millimeters with aligners, mainly in the premolar region, and it seemed to be mainly tipping and proclination of the lower incisors that took place. Greg compared this to other research on aligners, Zhang's 2023 paper, and actually showed very similar findings. Next, Greg went on to look at some of the controversial areas in his own research, and that was the use of CBCT to look at alveolar bone. Now, he explored the controversy, the idea that voxel sizes limit the amount of bone visible, and if it's very thin bone, it won't appear on a CBCT. He quoted the 2019 paper by Wan Li Ba, which showed actually CBCT data is almost as accurate as actual measurements on patients. We're talking 0.03 millimeters when it comes to bone height and 0.11 millimeters when it comes to bone width. Now, for me, interpreting this, there's still a grey area here, as what this data didn't look at is actual patients who have very thin levels of bone. And for me, that's still the area of controversy which exists. Can we predict the amount of bone loss that takes place on adults who are having expansion with aligners? Well, what Greg Huang showed in his study was that actually there are predictors for the lower arch, but not for the upper. Those include proclination and the quantity of expansion and tipping which occurs. Unfortunately, Greg Huang wasn't able to give a relationship between the two, i.e. how much expansion or proclination results in a certain quantity of bone loss. And partly that's because of the other parameters that he described, which was down from a study from Perello in 2023, which showed that actually, beyond just the proclination, it's the patient's biotype as well, the quantity of keratinized tissue, previous recession, and age, which seem to indicate how much recession a patient will have. The next question that Greg Huang posed was, does bone loss result in gingival recession? The presumption is that the answer should be yes, but that's not what Greg found. He cited an example, a patient having 3 millimeters of bone loss occurring, according to the CBCT, but actually far less gingival recession. Now, when it came to looking at previous studies, what he found was that Kim's study from 2024 showed significant palatal bone loss on patients having retraction of their incisors by the use of mini screws. Now, when these patients were followed up long term, in retention, it was found the palatal bone actually recovered. And this really starts to conflict with the idea that bone is needed to maintain the gingiva. And it also, does that mean we are getting new bone formation, or is this a different type of bony remodeling occurring? What Greg did state was how he thinks this happens, but it needs further investigation. And although the alveolar bone may disappear, the periodontal ligaments and the periosteum are still present, and they both have osteogenic potential. So if tension does occur between periodontal ligaments and the periosteum, new bone formation may well occur. This may well explain why bone loss itself doesn't necessarily correlate to recession occurring as well. Now, an interesting piece of research that's come out recently since this lecture was Alejandro Brunt's paper in the AJODO. This was looking at expansion with aligners again, but this time young patients at the age of 8 with Invisalign first. And what he demonstrated was that actually there was similar expansion between both aligners and rapid maxillary expansion. It clearly seems to be aligner expansion season within the research. That brings us to the end of this episode of Orthodontics in Summary. A quick update from me. I've been working with some developers to try and bring my IPR course online, so hopefully you guys will have access to that soon. As always, please do subscribe and look forward to the next episode.